Do you have jumper's knee or pain in front of the knee? In this video, I'm going to teach you why this might be happening and what you could do to fix it. What's up guys, Dr. Nick Bonforte. Jumper's knee, what is it? Jumper's knee is commonly referred to as patellar tendinitis or patellar tendinopathy. And what it is pain to the patellar tendon, the tendon on the bottom of the kneecap. So this tends to brew up in some painful stimuluses and sensations when it's overworked and overloaded, such as when you're jumping a lot, or it doesn't have to be just jumping, but when you're doing a lot of things that's overloading that particular aspect of the knee. Let's go over a little bit of anatomy so we better understand this. So the patellar tendon, it is located underneath the kneecap and it connects the bottom of the kneecap to the tibia. And this tendon has four muscles that basically have some connections to this tendon. The quad muscles. So there's four muscles that make up the quad. All of those go down, insert into the quad tendon, which is on the top of the kneecap, and then through fascial connections, it goes through the kneecap, down into the bottom of the kneecap to the tibia, the lower leg bone. So the patellar tendon pain tends to get sparked up with knee dominant strategies and movements. For an example, if you are going down the stairs and your chest is staying nice and upright and you're going down one by one and the knee is going over the toes, that's a knee dominant movement. It's loading up the quads, loading up the knee, and if the patellar tendon is irritated, it can tend to get sparked up with a movement such as that. Or for an example, if you're doing forward lunges, when you do a lunge and your chest stays upright, that's a knee dominant movement and it's putting a lot of force and effort to the quads and to the knee. That's not to say it's a bad movement, but if the patellar tendon is irritated, that's a type of movement that could spark up some of the symptoms. If you tend to ignore the modifications and movements that take off the stress to the knee, this could just be a recurring knee problem pain issue for you, and then it could also slow the progress in how it's healing. So you might be thinking, well, what are some of the exercises to help fix this issue? Let's dive a little bit deeper into some of them. The first up is isometrics. This is super important to help one, decrease pain. Isometrics have what's called an analgesic effect, which is decreasing the pain to the area, and two, it increases the strength and the load-bearing capacity of the particular tissue you're using. So here, I'm just using wall sits as an example to be a knee dominant movement with the intention to isometrically load this patellar tendon. So again, it decreases the pain and improves the strength and loading capacity of this area. The next up is knee eccentric. So when the knee is going through a process of getting stronger, as you do with the isometrics, when it starts to get adapted to withstand more effort and more force, you introduce eccentric. So here is an exercise I like to use, which is putting the muscles that attach to the patellar tendon in a lengthening position under load and control. So eccentrics have been shown to improve the strength and improve the loading capacity to ultimately help beef up the strength and to the area, which then ultimately helps take on more stress, more load, and ultimately gives you more adaptability to the region. The next up is using a strategy to emphasize a hip dominant movement to decrease the stress and load to the knee regions. Now the idea with this is when the patellar tendon is sparked up in pain, you want to modify your knee dominant strategies and movements to decrease the load and stress to the area so it calms down while building other areas up. For an example, if you're doing a knee dominant forward lunge, you would switch it to a hip dominant forward lunge to offload the knee, strengthen up the hip while you're still incorporating this movement as the patellar tendon is healing. So you can see with this one, when I do a reverse lunge, my chest is leaning forward towards my knee, which helps decrease the stress to the knee so that my hip is working more during this exercise. So there you guys have it, 3 exercises to help get a jump start on this patellar tendinitis issue or knee pain issue. So with this, the concept with these 3 exercises was 1, isometrically load the knee to ultimately decrease pain and improve strength. Once we get there, we do eccentrics, which elongates stuff and puts things in a lengthened position. We beef up and make it strong in a lengthening position to take on more load. And at the same time, introducing a hip dominant strategy to keep yourself moving and gain some overall strength while you're dealing with this patellar tendinitis issue. Guys, to really help out with the YouTube algorithm, it would be really helpful if you subscribe, like, comment, leave any questions or comments below, turn on your post notifications so you never miss a video. This is Dr. Nick. I'll see you next time.